Good afternoon, everyone. My name is Michael Gonzalez, Gonzalez, for our media friends. I'm the Communications Director for the City of Cary. Two things. First, each of you should have received, or can pick up, a handout that will describe the protocols that the Mayor will be discussing in just a few minutes. So if you want to take a moment to go and grab that, it might make it easier to follow along. Secondly, if you have a cell phone, please silence your cell phone. And in a few minutes, we'll make sure our media friends are ready. All right. Well, again, my name is Michael Gonzalez, City of Cary Communications Director. Biggest news, of course, all around is COVID-19. In response to the potential arrival of COVID-19, Mayor Prince convened a team to examine the issue, and he has made some decisions on protocols. You have that before you now, and the sequence today will be, as you see seated, Mayor, Dr. Walker, Dr. McNulty will make comments. Afterwards, we will open the floor up to media questions only. Again, afterwards, we will open the floor to media questions only. And with that, Mayor Jerome Prince.
Good afternoon. Thank you, Michael. So before we begin, I'd like to acknowledge the presence of other elected officials and dignitaries that are present. Of course, to my left immediately is Dr. Walker, Health Commissioner for the City of Cary. Next to him is Dr. Paige McNulty, CEO, Superintendent of Cary Community School Corporation. We're also joined by Councilwoman Linda Barnes-Caldwell of the 5th District, Councilman Duane Williams of the 6th District, Dr. Anita Johnson-Hughes from Edgewater Systems of Balanced Living, also our Chief and Deputy Chief of the Cary Police Department, as well as Chief and Deputy Chief of the Fire Department. Also is our Executive Director of the Cary Chicago International Airport, Mr. Duane Hayden, Chuck Hughes from Chamber of Commerce, and I believe that's it. So, over the last few weeks, as Michael has explained, we began the discussion, we being Dr. Walker and I, the Health Commissioner, around the conversation of COVID-19. Certainly, we didn't anticipate the gravity that would occur at this particular point, but what we did know is that at some point we would have a responsibility to share accurate and up-to-date information with our constituency. Today, we're prepared to do that. Upon a meeting conference call today with several entities, I believe the number was about 20 government and official entities across the county, we developed a particular strategy and a solid message, a concise message that we'd like to share today. And the attempt again is to not necessarily solve this situation, but to provide direction and most of all provide some sense of assurance to the residents that we as leaders of the community are prepared to address this situation to the best of our ability. So, without question, this is challenging for all of us. The COVID-19 updates change rapidly, and to that extent, the information that we receive changes just as rapidly. Because we do not have as much information as we'd like to have, and we have very little of what we can expect, the situation can seem frightening. It's hard for all of us to fully understand what's going on because things are changing so rapidly. One of the things that we can absolutely count on at some point is that someone in Cary or Lake County will possibly be diagnosed with COVID-19 virus. So the best course of action is to prepare now. I think of this as two challenges. One is, what do we do when the virus actually hits close to home? And the second one is, what do we do to keep things in perspective and to calmly inform our residents? As the mayor of the City of Cary, I encourage calm and I encourage patience. Things will probably get more confusing and perhaps a little bit scarier. In the next few days and months, we will get through this as a city, and I assure you that all the information that we share will be accurate, precise, and up to date. My administration has developed 2 protocols that we'd like to share with you shortly. First one is Protocol A. It's effective immediately. City of Cary and Health Commissioner Dr. Roland Walker has suspended all governmental meetings and gatherings in the City of Cary facilities for 2 weeks, beginning at 4 p.m. on March 13th. Also, all non-governmental meetings and gatherings with more than 100 attendees in all city facilities will be canceled for the same period. City of Cary will immediately begin a continuous disinfection regimen for all common areas in the City of Cary and its facilities. We will also post signs on all public entrances to all city facilities with information on the COVID-19 virus and the symptoms and the methods to slow down this virus. Protocol B is as follows. On orders of the Mayor or the Health Commissioner, all public meetings and gatherings in the City of Cary facilities will be suspended indefinitely. The City of Cary will stop all public traffic in all City of Cary buildings indefinitely. We will also cover the Genesis Center and all other city facilities with planned events and indefinitely suspend any new event bookings. Non-essential City of Cary employees will be instructed to stay home indefinitely. Essential City of Cary employees will be expected to continue their normal work schedules. We will initiate a work-from-home policy for qualified workers indefinitely, and myself and the administration will continuously monitor the situation and will host additional information sessions. At this time, I'd like to introduce Dr. Walker so that he could speak from a medical perspective and add a little bit more technical perspective to our present situation. Dr. Walker.
As the mayor said, my name is Dr. Roland Walker. I am the Health Commissioner for the City of Cary. I want to thank each of you for coming out this afternoon for a very serious matter. And I would like to thank the mayor and his team for working with me and giving me the latitude to be able to come up with to help to come out with a plan so that we can try to approach this, this outbreak in a very reasonable manner. First of all, I want to talk to you a little bit about the virus itself. And then hopefully I can dispel a couple of myths too. So first of all, I want you to know that anyone can be infected with the COVID-19 virus, okay? So that's regardless of race, that's regardless of gender, that's regardless of age. Now that being said, there are vulnerable populations. And we have found so far that the senior citizen population seems to be particularly vulnerable in this case. Also, immunocompromised seems to be particularly vulnerable in this case. Typically with viruses, they're very young and vulnerable too. We have not seen that so far, but we want to keep that in mind. And so there's been some questions about testing. Currently, nobody has tested positive in the City of Cary for the COVID-19 virus. The system is prepared to test upon diagnosis or evaluation of symptoms. And so then those tests would be taken to Indianapolis and be processed. If anybody has the symptoms during the testing time, they would be placed in isolation per the recommendations of the providing physician. Typically, isolation is a 14-day period, but that is to be determined by the primary care physician. You may ask about symptoms for the COVID-19 virus. Well, to be honest with you, those symptoms are very similar to other respiratory illnesses. You can see cough, fever, typically high fevers, and shortness of breath. And I want to remind you now that if somebody's having increased shortness of breath, that they have difficulty breathing just like anybody else or any other time, if someone's having increased shortness of breath, we would refer them to the emergency room right away. And you're also probably asking, well, what can we do to help prevent the spread of this virus? Well, you've probably heard a term that you haven't heard before, and that's social distancing. And what we are asking now is that we not have large social events because people who are in close quarters can spread the virus. This is a droplet spread virus, and so Typically, we say that 6 feet or more from somebody is typically safe. The virus can also live on surfaces. We're not exactly sure how long those periods on the surfaces are, so that is why we've initiated a protocol of disinfecting those surfaces, particularly in our highly trafficked areas of city facilities. You've probably heard about the uses of masks, and the most effective masks are the N95 masks. They're in short supply. Typically, we want healthcare professionals to use those to care for people who may have these symptoms, and also people who have actually been tested positive and wear those masks to prevent the spread. There has been a slight change, and we are now encouraging people who have any respiratory symptoms to also wear the typical paper surgical masks. We're asking them to wear those to prevent spreading those virus shed particles. So at this time, I would like to introduce Dr. McNulty, who is our emergency manager for the Cary Public School Corporation, who has some announcements to make about our Cary schools. Thank you.
Good afternoon, everyone. At this time, I would also like to echo many of the things that my colleagues have said here, that we too are going to be in an abundance of caution for our staff and students closing the Cary Community Schools for the next 3 weeks. We will resume April 3rd, and I will assess the situation as it evolves to see if we need to add more time to our closure. So again, we're closed, all events, all schools canceled until April 3rd at this time. We will, however, be providing meals to all of our Cary students and families, anybody who's 18 years or younger, at 7 local sites, 1 for each district, every Monday from now until April 3rd. That'll be Monday, March 16th, and I've brought flyers for everybody, and this is also on our website. Monday, March 16th, Monday, March 23rd, and Monday, March 30th. They will be able to receive breakfast and lunch that they can take home with them for 5 days. And these will be distributed at the New Hope Church, Trinity Baptist Church, Greater Stephen Baptist Church, Unity Baptist Church, the American Legion, the Career Center, and New Shiloh Missionary Baptist Church. And I want to thank them for cooperating and helping us with this distribution. Additionally, our staff will continue to get paid both salary and hourly staff during this time of closure. We have also sent home homework packets today with all of our students that they will continue to work on while we are closed. These packets will also be distributed at our feeding sites and have also been posted on our website. All of our schools and buses will be disinfected thoroughly during the next 3 weeks. And we ask that you please continue to check our website and our Facebook for updates. And we are going to continue to partner with the mayor and his team and other social service agencies as this evolves. Thank you. And at this time, I'm going to turn it back to Mr. Gonzalez. Yeah, thank you.
Thank you, Dr. McNulty. So before we open this up to the media, if you've come in since we began, there are handouts at the back table that will give you these details. And I want to point out a couple of things before I open the floor. On the first page where it says clinical diagnosis, etc. So these are the 3 events that would trigger Protocol B. So these are the 3 events that would trigger Protocol B. So as the mayor said and as the doctor mentioned, City of Protocol A will begin effective immediately, well, at least at 4 o'clock. And Protocol B is based on the 3 events that you see on page 1. So with that, do we have any media questions? Cary. Any one of those 3 would trigger Protocol B. Yes. Dr. Walker.
So, in terms of other institutions inside of Lake County, I can't speak. I have spoken with Methodist Hospital, and so far they have tested 2 people, and both have tested negative.
And that's, We talked about that this morning. I don't know, maybe doctors. I'm not clear on if that's the CDC test, the Indiana Department of Health test. I'm not clear if that's the one they used. Natalie.
First of all, Dr. McNulty, you said Trinity Baptist. Which Trinity Baptist? We have a couple. Okay. It's the one on Virginia Street. Also, what have we decided, like working with the Boys and Girls Clubs in terms of children having some place to go or anything where parents can't take off from work?
So Natalie, we've attempted to contact just about every entity or organization in the city of Gary. As I said, at 11 o'clock today, there was a press conference with 20 different organizations on the phone, and to that extent, I'm not certain if Boys and Girls Club were on there, but as we discussed earlier, this is a fluid situation, and so we very well may be called back to give additional information on Monday. Certainly, as we receive it, we'll certainly share it with the general public. So any public sponsored event, that being city events at city facilities, are suspended for 2 weeks immediately as of 4 p.m. As it relates to private events at city facilities, the number is 100. Any event over 100 will be suspended until further notice. So there are 2 events planned, if I'm not mistaken, one this weekend and one next weekend. Those will continue. But also, in addition to that, the Genesis Center has been advised to not book any future events. And again, I can't stress enough, if something changes, something catastrophic or more serious than what exists now, that being one of the triggers or protocol factors, such as we get a diagnosed case in the city, then that will obviously change and it'll be heightened to Protocol B. Yes, sir.
Mayor, what do you say to Gary residents who may be feeling vulnerable and afraid right now?
Well, I certainly understand that fear as a resident, as a citizen, and just as a person. I too have concerns. I want to assure them that we're going to continue to share the most accurate and up-to-date information with them. The security that I can offer now, as Dr. Walker added, is that presently there are no confirmed cases in Gary, Indiana, or Lake County, and hopefully that will offer some sort of assurance. Yes.
I looked up the OTH radio. We received a number of complaints from individuals who don't do Facebook, who don't do social media. And then when you think of our senior citizens in the high rise, how are we going to reach out to those individuals?
So as you can see, we also have our local public access channel here. Natalie, unfortunately, I wish I had an ability to reach everyone. We're using the most effective manners that we possibly can in sharing and disseminating information. But I guess for those citizens that you just described, the media, obviously WLTH and our local media that's here, as well as local access channel, would be probably the best way. And I would caution, or at least encourage, anyone who has this information and knows of someone who represents that clientele that you just spoke of, or constituency rather, that they share this information with them as well.
And if I could just add to that, Natalie, at 7 o'clock on Tuesday, so 7 p.m. Tuesday, we are planning a virtual, the mayor will host a virtual town hall, and that will be online, because that's probably the best way to reach, the most effective way to reach most people. But we will be following up with printed versions of different publications. So we'll do different publications as we go. This is probably only, as the mayor mentioned, probably one of, the first of a number of communication events.
Thank you, Michael.
Thank you, Mayor.
Gary. Thank you. We'll start with the inaugural ball. As of today, the inaugural ball has been postponed indefinitely. We will follow up with a date specifically that we will make sure that we're advertised publicly. State of the City address falls within the category of the other publicly sponsored events at city facilities within the next 2 weeks. The plan is to sponsor a virtual State of the City. We just haven't solidified a specific date with that. Thank you. The questions are actually for media, Quinn, so.
Yeah, so we're going to, for time constraints today, we'll just take media questions. Do we have any other media?
Yes, Michael. I would say for the most part, the communication has been fluid as well. Dr. Walker can speak to specifics on availability of tests, because I think that's more of a question for our medical personnel. But yeah, as recent or as far back as 3 weeks ago, when Dr. Walker initially engaged in conversation, state has been extremely receptive to taking his calls as well as sharing information. Dr. Walker, you have any other?
So, yeah, I want to echo what the mayor said. The state is in constant contact daily. We've had several webinars, conference calls, and multiple emails daily. As far as testing, there has been a slow rollout of testing. So if you're not aware of what happened, the United States decided that they wanted to develop their own tests. And the first batch of tests came out, and it just did not work properly. And it came from, from the CDC. So we had to roll out a second group of tests, and those are just now starting to distribute at the state level, and then they trickle over to our local level. So we haven't received any yet. Other countries have been using the German test, and the German test has been used a lot around the rest of the world, and that's why they're getting quicker results than we are.
Sure. Sure, so thank you, Ted. There's actually a local community, and I'm not exactly sure which one, that's performing similar procedures or tests. Speaking with Dr. Walker, he's working to establish some site or some protocol for possibly establishing drive-up testing as well. And so to your other point, in terms of a facility, or at least I believe Natalie, if someone answers the question, just today, I authorized the, Northwest Indiana Information Sharing and Security Administration building to build a command center at the Gary International Chicago, or Gary Chicago International Airport, and Mr. Duane Hayden is certainly here to perhaps answer any questions relative to that. But again, that's another attempt to be proactive, and the best, I guess, news that we have today that we can share is that as of now, there has been no confirmed cases. In addition to that, I could say that in the advent that one does occur, it's absolutely imperative that whatever information is shared on a consistent basis, and that we continue to work together as a team, as we have up to this point. Yes, please.
So as it relates to drive-up testing, so that's been a discussion for the last few days. One of the things that will have to occur with the drive-up testing, though, is that when you show up for drive-up testing, it still will require a doctor's order. Now, will that be through telemedicine? Will that be through your local doctor? That has not been established yet. But it won't be that anybody can just go and get testing in the drive-up. It has to be with a doctor's order.
If I, and one more thing regarding that, Ted. So Mayor Prince is committed to working with all the different communities in this area, including NISA. So not only are they going to open up that command center in the Gary Chicago International Airport, and they're working on that now, but they are also, in fact, investigating these drive-up facilities too. So that is something that's being considered locally in and outside of Gary.
Yes, Natalie.
You mentioned that the test will have to go, if you're in Methodist and they have to go down to Indy. How long of a wait time is that to get the information back? And how can we be assured that we're giving priority just as other communities will be as they send their testing?
I can't speak to the priority question. What I can tell you is I've heard of test turnaround in as quickly as 48 hours, but it can be as long as 5 to 7 days. So the process for us would be that a courier would come pick up the tests from Northwest Indiana, take them back to Indianapolis, and test it there. By car.
Yeah, I just want to add also, before we take another question, that our first responders were represented by the chief and deputy chief of the police department and chief and deputy chief of the fire department have been actively engaged in these processes also, and to that extent, they're certainly prepared with extensive measures to address public concerns as they encounter them as well. Yes.
Mayor, you mentioned the command center at the Cary Airport. Could you again explain what's going to happen at the center?
So I'd like to ask Duane to come up, perhaps to speak with the degree of specificity about exactly what's going on out there. Mr. Duane Hayden. Thank you, sir.
Staff, yes, I am Duane Hayden, Executive Director of the airport. To your question, sir, the terminal building will be used as a communication center. Once there's a trigger event of an incident in the 5 counties that NESA oversees, we will stand that facility up for command and control. The acronym NIMS, National Incident Management System, and Incident Command System Protocol is the doctrine for emergency response. NISA staff is trained in that. The chief of police and fire, first responders, hospital personnel are all trained in this discipline. That will be the model of our response, and the Cary Airport will be a support entity for the mitigation and response to this crisis.
But that's where people would theoretically be tested?
No, sir. That is command and control for mitigation and response protocol per the doctrine of emergency management. So it's command and control on a unified and a joint initiative for the 5 counties of Lake County and the Cary proper.
Yes. So senior citizens would be the first, and that seems to be the most vulnerable population at this time. And that's where we've seen most of the deaths. Okay. Also, the immunocompromised, and so that could take a wide range, and that could be diabetes, that could be any type of other infectious disease. So anything that makes you cancer would be another one. So anything that makes you immunocompromised. Now, typically, also with respiratory viruses, the very young are vulnerable. So far, and we have very limited data, so far the very young don't seem to be as vulnerable as with other viruses, but because we have so limited data, I think it behooves us to go ahead and treat this like we would treat any other respiratory virus.
Could you also mention one more time about the mask that should be worn, as you said, the N95 and private?
Sure. Well, there's 2 types of respiratory masks that would be suggested at first, and that's the M95 and the M99s. The M95 is the most common one, and those are the ones that have flown off the shelf very fast. And so we caution against people buying up masks and hoarding them, because then we can't use them for medical needs, right? And then you have the typical surgical masks that you will see, like if you were to go into the hospital, in any hospital right now, they'll have those at the front, desk, and they'll ask you to wear them if you're going and you have any type of respiratory condition, common cold or anything like that, cough, sneeze. And so the new recommendation with those is that anybody now with any respiratory illness, if you're going to be in an area, to wear these surgical masks.
Cary?
So I guess at this time we should bring the first responders here. We have Chief Ligon from the Cary Police Department, as well as Chief Sean Odonell from the Cary Fire Department.
We provided all our officers with gloves, and also we're giving them the option of whether to incarcerate or not on an on-call basis. We're gonna let them make that decision. So if it's somebody that it's not necessarily to arrest, they'll probably let them go if it's nothing serious. So we're trying to just minimize incarceration. We're basically taking full control of this building as far as letting people in and out between certain times. But for the police officers, we're definitely equipping all of them with enough gloves to handle each situation.
Chief Odonell?
Good afternoon. Our fire apparatus is all equipped with gloves and masks and gowns for our crews if they come into a potential situation of that. And our guys have been to class getting ready for it. Plus, we have some special kits that'll be on our fire and ambulances out there. And Lake County Dispatch is also trained if somebody calls. They have a protocol questions to kind of give us an idea of what type of response we're going to be going to, so we have an idea when we arrive at somebody's house for a call of service.
Natalie?
The one concern is homeless people. You know, they're out there in the elements and different things like that. How would they be able to get to testing facilities if maybe they're already ill? What are we doing about our homeless population?
Well, so how I would respond to that is we would behave as though it was any other type of virus. So typically, and it's not ideal, but typically in the homeless population, if they became ill, they would most likely end up in our emergency rooms, and that might be the only option we have at this time. So I just encourage people to think of it like they think of any other illness. If you would have called your physician and said, hey, I need to go, I have something going on, call your physician. If you're having increased work of breathing, it's an emergency, you need to go to the emergency room, go to the emergency room. And particularly with the vulnerable population that you just mentioned, typically they would be in the emergency room.
Any other media questions?
So if not, I again want to thank everyone for your attention and your responsiveness to this critical mass situation. Certainly want to thank Dr. Walker for his work over the last 3 weeks with the state facilities, with the CDC, as well as with our local healthcare provider, Methodist Hospital. Thanks to Michael Gonzalez, our Director of Communications, who did a fabulous job of arranging and organizing all of our, or most of the government entities around the city and certainly around the county to ensure that we had the most accurate and up-to-date information and that we deliver a consistent message to you all. Thank you again.